And welcome back to The Factor. Uncensored. Trial that affects young transgenders across the country has begun in Arkansas. The state's ACLU chapter is going against the state, filing a lawsuit that would stop a ban on gender-affirmed treatment for anyone under 18 years of old. Joining me now here on The Factor Uncensored, members of the LGBTQ plus community, Javon Martin, Ethan Michelle Gonzalez, and Mo Cortez. So before we get started, give us a little bit. I told you I'm just like the viewer, nosy, and I want to know. Give us your journey. So biologically and where you identify now.
Okay, well.
At birth.
Well, I was assigned female at birth. I'm transmasculine and non-binary. But I've always known that I was not what they said I was.
Mm-hmm.
And so I've known since I was 6. I picked my name out, Ethan, when I was 6 years old. And I'm 46 now, and I was able to change my name this year. And so.
How was that for you?
It was awesome. So 40 years later, after I picked out my name, I actually changed my name to that.
Okay.
They say kids don't know, but I was 6 and I knew.
And you knew then. Mm-hmm. And now you're happy.
Yes, and I had to actually started my medical transition because I was having some problems with my hormones. Mm-hmm. And I went to the doctor, and it ended up I actually needed the testosterone to fix what was going on with my body. And so my body needed the medical transition. And now I'm 6 months in, and now all my symptoms are gone, and I feel so much better.
New place in life. All right, and Mo, you've been here before, right?
Yes, sir. I've been here before.
I'm sorry, my earpiece. So tell us your journey.
Yeah, I'm Mo Cortez. I'm intersex and trans. So when I was born with a body that was born indeterminate. So they couldn't tell what I was. So the doctors pushed my mother to make me female, but she was able to hold back and able to fight back and able to contest that. But whenever I was 5 years old, they turned her into the CPS, stating that she was raising a little boy as a girl. So basically, they performed surgeries on me to remove my testes and my genitals to appear female. But I'm also trans too.
And when you became an adult and you realized what they did,
I realized it when I was a little kid. I realized it, but it hit me at different stages, 18 and then 30. 30 it finally hit me like. I need to take testosterone. That's what I need. That's what my body needs.
Mm-hmm. John?
Yeah, oh wow. That hits home. So I was assigned female at birth, and I'm here today 23 years later as a male, and I live my life as a male. I only accept transgender terms when I have to disclose.
And when you say transgender terms, what does that mean?
That means I don't disclose unless it's for medical reasons or to be counted as a trans person. Mm-hmm. The National Center of Trans Equality did a survey in 2015, right? And that's what we've been going by medically for housing and everything. So they're actually coming out with a new one this year. But I stand up to be counted for that because they need to know the numbers of how many trans people there are and what the needs are. So yeah, I'm here 20 some odd years later, and I feel great. I knew there was something wrong with me. I just didn't know what that was, because 20 something years ago, there weren't any trans men. There were trans women, but that's not the terms they use, tranny, transvestite, but I didn't see anyone who looked like me, right? And so now I'm here to mentor those and to hold space for those that are looking for someone.
And so when someone who's looking for someone like you and they find you, what is that like? What has been their reaction to you?
It's more like a relief to know that they're not alone, because I was alone. I didn't have anyone to follow and say, hey, this is what I feel. So when they come to me, they say, hey, I don't know what's going on with me. So I just listen to them, because that's all they want. They want someone to listen to them and hear them and know that they're going to be okay. And I just help them find their way, whatever they want to do. I don't coerce them, I just hold space. And this is what you want to do? Sure. And if it's not what you want to do, that's even fine. Just get under care mentally. We want to make sure people are okay, and medically.
Now let's get back to the legislative action that we're seeing around the country. And it has been what we have seen anti-LGBTQ plus around this country when it comes to especially conservative states. And what many young people are finding themselves moving from state to state because gender affirming care is not welcomed, it's being banned, it's being pushed out. So Mo, when you hear about this, your thoughts about this legislation that we're seeing pop up around the country?
Well, I can tell you about it. I actually testified against one of these bad anti-trans bills where they wanted to discontinue professional health insurance for physicians who perform, different surgeries or prescribe different medications and things like that. But I testified to say that it's discriminatory against trans people, but it's also discriminatory against intersex people because in the legislation they have XX and XY, but you can also be born XXY or XYY or XYXO. So there's so many. They got to look at the science. They didn't use science or ask anybody when they developed this information.
Ethan, let's hear from you.
I agree with Mo. I mean, they're just basing it on biases. I mean, this bias of the idea of a gender binary was brought here by white supremacy. It was brought here by colonization, by European colonists. There were 155 Native American tribes that recognized between 3 and 5 genders that are on record.
Really?
Yes.
So Nora, you heard that? We're going to have to explore that, 3 and 5 genders, but go ahead.
So when the white people came here, part of the genocide of the peoples that were already here was the genocide of their cultures, which included how they saw people who were gender expansive, and they saw them as divine. They had special places in their cultures. And then the white people come here and destroyed that and killed them for doing their thing and trying to make them assimilate.
Mm-hmm. All right, Javon, you wrap us up here.
Yes, and I can definitely agree with you on that. So what happens is, if they're not familiar with this, it's not like them, they want to get rid of it. And that's what it was, right? So two-spirited people in the indigenous world has been here for many years. So it's not like them. They don't want to hear it. They don't want to see it. We're going to exclude it and kill them. So yeah.
We could have gave you guys the whole show.